Hi, my name is Grace Briantis, and I'm a Saginaw Valley family nurse practitioner student. Wondering if I could get your consent to do a ear examination, a mouth examination, and a nose examination.
Yes.
Okay. So we're going to start with the ears first. So I'm just going to go ahead and look at the front and the backs of the auricles and palpate the trachea here. Rub behind the mastoid. Any pain felt there? Okay. Gonna go ahead and try this one here. Palpate the trachea, mastoid. Any pain there? Okay. So the ears are aligned. There are no lesions or bumps that I am concerned about. No cuts or bruising. Um, okay, so I'm going to go ahead and look inside of your ears, okay? Um, Actually, I'm going to do this test first, okay? So what I'm gonna do with this, I'm gonna bring it on my hand, I'm gonna set it on top of your head. You're going to tell me if you hear the sound at all, or if you hear it, and if you do hear it, if you hear it in one ear more than the other, or if you hear it equally in both, okay? You hear it equally in both? Okay. Now what I'm going to do is I'm going to go ahead and bang it on my hand again. I'm going to place it behind your ear, right on your mastoid bone there. You're going to tell me when you can no longer hear it. And then when you can't hear it anymore, I'm going to pull it away next to your ear. And then you're going to tell me when you can hear the sound again. Okay?
I can't hear it. I can hear it.
Okay. So air conduction is greater than bone conduction by 6 seconds. So now what I'm going to do is I'm going to go behind you and I'm going to have you plug one ear and I'm going to whisper a two-syllable word to you and you repeat what I say, okay?
Hello.
Yeah, okay, now plug the other ear.
Water.
Yep, good job. Okay, so at this time I'm going to ask you if you can remove your glasses for me, please. I'm going to palpate your frontal sinuses here. Any pain? Okay. And your maxillary sinuses. Any pain there? All right. So now I'm going to go ahead and take a look in your ears. Just going to be looking for any abnormalities in there. And pull the earlobe up and back. And the ear canals are nice and pink. Don't see any cerumen or any swelling, cuts, lesions. And your tympanic membrane is nice pearly gray with no perforations noted. Gonna take a look at your next one. And no cerumen there. Nice smooth pink. No cuts, lesions, bruising. Tympanic membrane is intact, no perforations, and nice pearly gray. Okay. So now I'm going to go ahead and I'm going to transilluminate your sinuses. Okay. I'm going to have you tilt like that. I'm going to put it right below your brow bone and sinus Frontal sinus is transilluminated there. And frontal sinus is transilluminated there. Now I'm going to transilluminate your maxillary sinuses. So right below your eye. You can open your mouth for me. Say ah. Okay, it is transilluminated there. And ah. And transilluminated there. Good. Okay, so we've done that. Now I'm going to go ahead and take a look at your nose. You can tilt your head back a little for me. So your nasal septum is midline. Nares are even. You feel any pain or, okay, no nodules noted there. I'm going to have you plug one nair and breathe through the one. Any difficulty? Okay, go ahead and try the next one. Any difficulty there? All right. So now I'm going to go ahead and take a look inside of your nose. Go ahead and tilt back. Can definitely see those turbinates. They're nice and pink. I see some hair. No bleeding, no swelling, no redness. Look in this one. Can definitely see the turbinates there. No swelling, nice and pink. No lesions or bumps. All right, so now I'm going to want to go ahead and take a look at your mouth. Okay, we'll start with your lips. Your lips are nice and pink and moist. If you can open your mouth for me, stick out your tongue and say ah. So your tonsils are nice and pink. Your soft palate is pink and smooth. Hard palate is also pink and smooth. Don't see any cuts, bruises, lesions, or bleeding. Your mucosa, nice and pink and smooth. Tongue has the papillae on there. No cuts, bruises, discoloration. Go ahead and lift your tongue up for me. All right, looks nice and pink there. Open mouth, say ah. I'm gonna feel your teeth. Don't feel any loose teeth there. And your tongue is good. Normally I would use a gauze, but I don't have a gauze, so I'm going to just use this and lift your tongue up. Go ahead and stick your tongue out for me. Look at the sides. All right. Okay. And I think that's it. Well, thank you so much. Have a good day.